This is the contrast and CT scan of left temporal bone of a 34 years old male patient. The patient is already a known case of left mastoiditis and chronic suppurative otitis media. Please see this expansile lytic lane which has involved almost all of the Petrous part of left temporal bone. There is no enhancement of its inner components. Please observe the extent of bone erosions and expansile lytic lane. Here the cortex is eroded anteriorly. Superiorly the roof was also eroded. Now this is the internal auditory canal on left side. The lesion is extending up to the anterior wall of the internal auditory canal. However, it is intact. Low down, this is the carotid canal here. In this region, the wall of the carotid canal is eroded. However, there was no involvement of left internal carotid artery. This is the region of the middle ear cavity. This is the handle of malleus which is visible. The rest of the ossicles could not be visualized clearly. This is soft tissue attenuation medium in left mastoideal cells. No bone erosion here. This is suggestive of left mastoiditis. The erosive process has involved the middle ear cavity as well. The patient presented with left facial nerve palsy. This is the localized view, magnified. Internal ear structures are normal. This is the cochlea. These are the semicircular canals. These are the eroded middle ear ossicles. This is the handle of malleus. The soft tissue attenuation mass is projecting into the middle part of left external auditory canal. There is no extension of the lesion into the posterior cranial fossa. This is the coronal view. Please see expansile lytic lane which has eroded the superior surface of the Petrous part of temporal bone. Middle ear cavity. This is the brain window. Please follow. This is the internal carotid artery here. This is the carotid canal. In this region, wall of the carotid canal has been eroded. However, there is no involvement of the internal carotid artery. This is just to show you the soft tissue extent. Anteriorly, the wall is eroded and the soft tissue attenuation mass is extending into the posterior part of left middle cranial fossa. However, it remains extradural in location and there is no involvement of adjacent brain. Posteriorly, there is no extension of the mass into the posterior cranial fossa, although it lies in contact with the anterior wall of left internal auditory canal here in this region. This is the sigmoid sinus. There is no involvement of sigmoid sinus this is the jugular bulb here. No involvement of jugular bulb or the sigmoid sinus. The features are suggestive of left Petrous Cholesteatoma. This is very rare and represents 3 to 9% of all of the temporal bone cholesteatomas. The other possible differentials in such cases are the squamous cell carcinomas and the metastatic lesions, but these are generally aggressive and not expansile. They erode the bones. and there is an associated soft tissue mass which extends into the adjacent brain, while the patient is already a known case of left-sided otomastoiditis and has now presented with left facial nerve paralysis.